Dr. Martha Whyte, State Office of Public Health, Regional Director. Hey, Dr. Martha, welcome back. Happy New Year. Thanks for taking time.
Hey, how are you?
Let's look at 2020, coronavirus 2020. Let's go back to...
Boy, has your life changed.
Maybe January or February or earlier maybe even late 2019. When was coronavirus, COVID-19, first on your radar? Was it late last year, early this year? What do you recall?
So, it started late last year in other parts of the world, started coming over here. What we knew was early, 2020, but now they're looking at, if you watch the news articles, they're looking at cases perhaps in other parts of the world earlier than we expected. So I've had a lot of people who told me they traveled and perhaps they had it in November of last year. And we were always like, I don't think it was here yet. We don't think it was outside of China, but it might happen.
So it's maybe January, February of 2020. And you see you're getting like maybe news reports or inter-office memos from other parts of other parts of America. When did people in your profession start to look at this and go, this could be a mess?
Well, we started looking at it in December, probably about a year ago, when it was kind of blowing up in other parts of the world. As, we started having, remember, the cruise ships and the issues with international travel and the banning of people coming into the country, which all probably started a little too late to stop it from coming in. The world is so small with travel now. But it really came into Louisiana in January or late January, early February, and it got up here in early March.
Dr. Whyte, we're into the vaccination stage now, which we all were told was going to be a game changer. President-elect Biden is promising 1 million vaccines a day when he takes over. Is that realistic?
So as we get more and more vaccines approved, I think we'll see more and more vaccine available. Once they were able to, it was such a cost issue. They had to have some sort of approval so they knew that they would be able to recoup all the costs that they put into making it. So I think you'll see more vaccine becoming available every day. And as we get more vaccines added to the list, of course, that will grow. So I think it's reasonable. Whether it'll be that quickly, I'm not sure.
And is the vaccine as big a game changer as we've heard, and how soon?
So, of course, you have to have your 2 doses to really be protected. And then, people have all asked me, well, does that mean we can all stop wearing masks? And what about quarantine? So here's the hard part. When they did all their trials, they looked at whether they protected people from becoming ill. They didn't look so much at the transmission from, even if I was exposed, was I able to then transmit it to other people even though I didn't get sick?
I'm sorry, finish up.
No, we think that you are probably protected from transmitting it to other people, but they have to do that part of the study. So they're doing that now. It's been ongoing, but until that research comes out, even people who are vaccinated, we're still going to wear a mask for a little while longer. And it's going to take a while to get enough people vaccinated with both doses anyway. So hopefully by the time that happens, we'll have the transmission data and we can kind of go back to
that was going to be my next question, and I forget the doctor's exact name with the WHO, Hyena Sanamanamar, and she had said a couple of days ago, she said, well, just because we have a vaccine doesn't mean that if you have the vaccine that you still can't get and or transmit the virus. And I thought it's the WHO is all over the board. They're influenced by a lot of different governments around the world. What are your thoughts on what she said about that very statement? Do you think she was overstating? Do you think they're being cautiously cautiously not so optimistic?
I do think they're being a little pessimistic. I think we don't know. We don't have the data to prove it, but I think the people who have worked in the trials, Dr. Van Cherry up here worked in the trials, and for Pfizer, I think they believe that the transmission will also be decreased. We just have to prove it before we can say, okay, everybody relax. But that's ongoing. So hopefully, like I said, we'll see that data relatively soon.
We have to talk about the tragic news we got yesterday, the death of Congressman-elect Luke Letlow at age 41, which is a stark reminder again that some people are lucky with this virus and some people it's tragic. You're hearing these stories every day. This happens to be a very high-profile case, right?
That's correct. I mean, you know, I tell people I've seen so many young moms. We've had multiple young moms die in our area who never got to hold their babies. There was a story in the national news about that. I'm like, we've seen that here. You know, they're young, healthy women got COVID while they were, you know, at the end of their pregnancy, were able to deliver their baby, and then they passed away. We just don't know who's going to get terribly sick. And we don't know, we're also concerned about those of us who got the virus and maybe didn't get very sick, how long you're protected. They've looked at some people, they have good antibodies, and some people do not. So are you at risk for getting it again and perhaps getting it worse?
Mm-hmm. Let me ask you this, Martha. Excuse me, Dr. Whyte. I apologize.
Yeah, you hardly know each other.
What? By the way, I'm not eating black-eyed peas. You put that on your face. Not happening. Sorry. Disgusting.
Can you imagine a scenario?
I don't care how healthy they are.
Dr. White's on the phone. She says black-eyed peas will cure you of coronavirus.
Oh, wow.
Yeah, you're in a mess now.
Then
aren't
I'm
you,
eating
kid?
them.
Yeah.
One more thing, and this isn't meant to be an uppercut or a jab or whatever. What is the biggest thing that surprised you during this pandemic and in all of 2020?
How political this got. I really feel like it's a health issue, and somehow in this country we allowed it to become a political issue, and that prevented us from handling this virus the best way we could. I also have been very disappointed in how, you know, I've said it, you follow me on Facebook, how we can't seem to put our community first. We put our needs and our wants and our me first, as opposed to our community, and we're the first generation that's done that.
Dr. Martha, pardon me. You said
Yeah.
something very interesting. Last question, I promise. You said the politicians, it became political, kept us from handling it the best way. What would have been the best way?
Well, I think we needed to take this a lot more seriously a lot earlier. I think there have been a lot of questions about how soon the people at the higher echelons knew about the danger of this virus. I think the idea of masking and not putting that as a mandate on a national level, not encouraging it at least on state levels from the national government, saying it's a nothing virus, saying don't worry about it, oh, you won't get sick. Well, you may not, but you may. And now we have 1 in 1,000 Americans who have died. We've had 7,300 Louisianians who have died in like 10 months. We had 11 people die in our region in the last 2 days. So it's not just a nothing virus if that's your family.
So just to sum up, you don't think that you think that politicians, that government leaders, that the people in charge have not done enough, that they haven't put enough shutdowns, enough restrictions, enough mandates in place?
Well, I think we made it all do what you want. You know, if you want to wear a mask, wear a mask. And we've allowed people to say, I don't want to do that. And I understand that this is America and we have rights and freedoms, but we also have a duty to protect our neighbors and care about the people around us. And when we don't do that, it's just wrong. You may not feel like you're going to get sick, and that's okay, but you going out without a mask harms other people. It's not just your choice because you're hurting other people by doing that.
Dr. Martha Whyte. Happy New Year to you. Thank you for your many visits with us this year. I'm sure we will chat again in the new year.
And enjoy the black-eyed peas, young lady.
Yes.
I hear they're incredibly healthy and loaded with
You can have my share.
and loaded with fiber.
I will eat your share so that you will have some luck too, Miss Aaron.